Dr. Robert Cutchen, founder of the Albuquerque Vein and Laser Institute, is back with us with solutions to painful vein disorders. Welcome, Dr. Cutchen.
It's great to be back.
Always great to have you
Thank
here
you.
on this Monday morning. You know, we always start a new week thinking about ways to make our lives better.
Right.
So the first question I have for you is, when should a person consider vein treatment?
Well, varicose veins are extremely common. It's estimated that 15 to 25% of Americans have varicose veins.
A lot.
And if you don't have them now, there's a decent chance you may have them somewhere later in life. And our primary motivation in treating varicose veins is just to help your legs feel better and look better. So a person should consider vein treatment if they're tired of looking at ugly veins, or if they're tired of feeling discomfort in their legs, feeling heavy, achy, tired feelings, that they find themselves always kind of kicking up their legs on the couch at the end of the day.
Exactly. I mean, and really, at the end of the day, all we want to do is feel good, but
Right.
we feel better when we look better.
Right.
I mean, it goes hand in hand. And so, over the years, vein treatment has changed. I think there was a time where people were probably more intimidated and afraid of it,
Yeah.
but it really has changed, hasn't it?
It's changed a lot, and that's kind of the greatest thing, is that the days of going to the hospital and being knocked out in surgery and having to have a big recovery is really behind us. Everything that we're doing nowadays is done in the office. When we're done with our procedures, I pack my patients up and I give them a bottle of water and I send them outside and I have them walk around my neighborhood for about 20 minutes before they even get in the car to go home. So you're immediately back on your feet. So really the kind of the old days of the rough surgery is behind us, and so that's really cool. Just immediately back on our feet and on our feet.
Yeah,
and,
literally,
and,
yeah.
and just feeling better and looking better.
And I've said it to you before, but it really is a comforting thought for people, because if
Yeah.
they were nervous or intimidated, to know that you're mobile right away
Yeah.
is a really good thing. And you know, when we think about any kind of treatment, we always want to know what kind of results we can expect. And so
Yeah.
let's take a look at some of these results so people know the difference.
And we really, what I love about what I do is we can get some great results. I personally have had everything done to me that I do to my patients.
Wow.
And I got some great results myself. So here's a pretty cool picture of a before and after of a patient. And these are pretty typical. This was kind of a good one, but these are pretty typical. So I think there's one more after this, maybe. Here's another one. It's kind of a front view of a big bulgy vein on that right leg.
Look at that difference.
And most of these pictures are taken about 6 weeks to 6 months after our treatment, so we can get some really great results.
So you say 6 weeks to 6 months, so basically based on your specific needs, it varies for each person?
Yeah, it's kind of
Okay.
depending on what you're starting with.
Now, there are different types of veins, and you and I have talked about this, but for those who have missed, tell me a little bit about spider veins.
Spider veins are those real fine, little red, little blue, purple veins that you get on the leg, and they're essentially always considered cosmetic. And here's also a real good before and after of the spider veins. And these veins we treat with sclerotherapy, which is injections. They're little bitty needles, but we inject these veins with a medication called sotradecol, or another called polydocanol, that chemically damages that vein, closes it down, and they fade. And it's a slow process, that fading. This again right here, this is about 6 months later, but you can get some really great results. And it's just a wonderful treatment.
Oh my gosh, when you look at those pictures, you realize how worth it is. 6 months is nothing when you can see those kind of results. I mean, that is really success. And so I know a lot of people don't like to talk about it, but you know, your face often has veins too that are apparent, and that maybe could be a little bit making somebody feel self-conscious.
And it's really common to get kind of verifying spider veins kind of on the side of the nose, sometimes up on the cheeks. And we have a really neat procedure called vein wave, which allows us to treat those facial veins, and they go away much faster. This is not this 6 month waiting thing. Usually after one treatment, they really fade very nicely. It's a really cool procedure.
I have to ask you what I know people watching are thinking. Does it hurt?
You know, it's a very tiny needle that just goes just under the skin, and you step on a little foot pedal, and it kind of gives a little zap of radio frequency energy to that vein and closes it. And it's not too bad. It's really not that bad, and it's much less uncomfortable than a laser on the skin.
That's great.
So it's really great.
I think that's really important for people to know, just because you know what, you want to know what to expect, and obviously when you see those kind of results, it's amazing how far the medical treatment has come.
It's pretty cool.
It's great. And you also do, I know, free screenings. In fact, viewers can find out more as well as get their free screening next Tuesday. So what are the details on that?
This is an event we have planned where patients can come in and meet with me. It's pretty quick, it's 5 or 10 minutes, but it lets me take a look at their facial veins or their leg veins and kind of talk about what kind of treatments they might be a candidate for. Some patients I will have them come back and we'll do an ultrasound of their legs, which is how we really figure out what's going on with varicose veins. But it's a nice chance for people to come in and kind of meet me and get a quick idea of what they might need.
He's very, very friendly. No, but it's true. I mean, it's really important, I think, with any kind of treatment, as far as the medical field goes, to feel comfortable with the doctor that you're working with.
I agree.
So we appreciate everything you do, and you do great things for people. Let's tell everybody how they can find you.
Thank you. The best way to find us is actually on the web at albuquerquevein.com, or you can phone us at 848-VEIN, and we can answer any question you might have.
Perfect. Dr. Cutchen, always great to have you.
Thank you so much.
Thank you.